My name is Dr. Daniel Cameron. I'm an internist and an epidemiologist. That means I trained, have a degree in medicine from the University of Minnesota, but I also have a master's degree in the School of Public Health in Minnesota in the field of epidemiology. Epidemiologists study epidemics. Most epidemics tend to be acute, like viral type things. In my case, I'm very involved in the chronic disease epidemiology, chronic illness related. I practice in Mount Kisco, New York. I've been practicing since 1987, and I've been enjoying being a preceptor for ILADS. Well, I came to Mount Kisco and had a general practice, but again and again I would see more and more people who had Lyme disease who weren't getting better. They had the standard 21, 30 days of treatment and they stayed sick. They weren't getting better with the standard treatment. What I find is that people who have Lyme disease can be quite sick, and it can mess up their fatigue, the headaches, joint pains, concentration. So they're trying to go to school, they're trying to work, they're trying to be in their family, and it's so devastating. So totally separate from the politics is one-on-one in that room. It's just a challenge to try to get somebody better who's been sick for a while. Well, when I first started in '88, I had 3 people that I really got to know Lyme disease really well just by really spending a lot of time with those first 3. One of them in particular had been taking doxycycline and it wasn't working. So they went up to see Dr. Steer in Boston, and Dr. Steer said, "Why don't you try amoxicillin?" So it was like the very first time I realized that a patient I was taking care of could just get better by just moving on to another antibiotic. And she was able to get back to work and being able to be a mother and take care of her family just by changing in antibiotics. I think the challenge that I see is that the research that's out there that clearly supports treatment has been around. It's been around since 1990. You know, I was very excited about the kind of research that was available. It's just that now, 23 years later, the most important issues are not being recognized. Doctors are still overlooking it. Doctors are still saying it's not important. But this type of person who has fatigue, poor concentration, poor memory, lightheadedness, dizziness, irritability, numbness in her hands and feet, that person that you might see might easily write off as a psych case, they just have a tick-borne illness. And it's so important to really get on with the knowledge as a doctor, recognize those types of patients and treat those for a tick-borne illness. The training program allows me to not just write about Lyme disease, publish about Lyme disease, but it brings a doctor who's quite interested in learning, quite interested in looking at what does a Lyme patient look like. They come in and they can see dozens of Lyme patients all in the same week. They can see the range of people who are quite sick and those who are getting better. And by seeing the range of illness, seeing the types of antibiotics that we use, the length of antibiotics that are important for some patients, it's very satisfying to have a doctor immersed in Lyme disease for a week, and then going back to their community and being able to not only read the literature on Lyme, but use it in their practice. Well, I think that training for me involves that one-on-one with another professional. You know, when I see a doctor who's been to medical school, been to residency, and they've been easily told, well, just treating a patient with fibromyalgia, chronic fatigue, or multiple sclerosis, just that discovery for seeing a doctor look past what they've been taught and looking at what's going on with tick-borne illnesses and being able to make a difference in that patient's life. That one-on-one with a doctor for that week is a very special experience. When I start on Monday working with the doctor in a training program, and there's so many questions that come up from what they've read, so much of what they've been taught, and when they first ask questions, it's sort of a gray area, it's challenging. But by the end of the week, by end of Friday, they're able to see over and over again the same types of cases, the same types of presentations, and they're able to see people getting better, looking at a tick-borne illness. That it's just interesting to give those doctors a special experience of understanding medicine at a different level. It really brings doctors to a higher level in understanding the complexities of illness and the burden of illness and the rewards of getting someone better. Well, I find that I can write, and I do write on Lyme disease, but the physician training program to me is that one-on-one experience with a doctor where I can take the doctor step by step through the literature, through the patient, have them in the exam room with the patient, have the one-on-one exchange with the patient and the doctor here, and it really makes Lyme disease real, and it really connects with the literature, connects with the person, and helps the doctor being able to look at Lyme from a different perspective. Certainly the doctor has learned a lot and is great at what they do, but just adding that extra dimension, that extra understanding of Lyme disease, I think can only do only offer wonders for someone who wants to grow as a doctor, wants to expand and understand what sickness is, but also how to get someone well. I find myself inspired more on the one-on-one experience with taking care of somebody who's had Lyme disease, who doesn't get better in 21 days. It's nice when they get better, it's nice when when 21 days works, but there's so many people, in fact a third of people in studies are still sick a year later. But to take someone who's been sick for a year and come up with just a different antibiotic, or look at Babesia, which is a parasite that can cause someone to remain sick, take those types of treatments and really make a difference. And so that one-on-one relationship that being a doctor allows me to be, I can make a difference in that person's life, get somebody better who might have got caught up with just treating the symptoms. That this fibromyalgia dead end where they can just treat the pain, we look again a second time and find that if a tick-borne illness is there, you can get at the whole underlying illness as opposed to just treating the symptoms. But I think as a doctor who comes to a physician training program, sits with me, they're asking on Monday some pretty simple questions, a tick bite, a rash, why is an ELISA test not so reliable, why is a Western blot only got 2 bands where they need 5 bands, all those types of simple questions. And then when I take a doctor through that, all those steps, is they can ask more and more sophisticated questions, and that one-on-one in between each patient really gets to an understanding of tick-borne that's will begin a lifelong learning process by setting that foundation in my office. There's physicians that see people with Lyme disease in all kinds of specialists. Somebody who has foot pain might go to a podiatrist or an orthopedist, and it turns out that they should be comfortable with Lyme disease. If they have the synovitis or bursitis, where they've been told it's a trigger point, that could be Lyme disease, and that means an orthopedist, rheumatologist should be comfortable with Lyme disease also. Psychiatrists should be aware that irritability and anger could very well be Lyme. This variety of emotions could be Lyme, and so no matter how much they know in any of these specialists, and they're specialists that my patients see all the time, if they can only add that extra dimension, that extra layer of understanding about a tick-borne, they can only expand what they do. They can offer an extra layer of treatment if that person needs it. And even if they're not treating, they can be supportive of somebody with Lyme. They can be at least giving that patient some ideas that Lyme disease can cause that, and they should at least go to somebody that's comfortable with Lyme, that knows Lyme, that can look at that angle, instead of just sitting there and saying it's just chronic fatigue or just an anxiety disorder. For more information, you can contact ilads.org on a physician training program and all the other things that the professional society is up to.